Well, two local board-certified plastic surgeons are suing the Knox County Health Department and the Board of Health over the mask mandate. Dr. Jason Hall and Dr. Stephen Smith filed a lawsuit on July 24th. And this morning, for the first time, Dr. Hall is talking to us about how he thinks the county's effort to slow the spread of COVID-19 is causing damage.
We are not looking for money from the county or from the health department.
Dr. Jason Hall says there are two reasons for the suit. One, he says recent decisions by the Knox County Board of Health violate the Tennessee state constitution. Two,
the data that these unelected government officials are using to pass these unconstitutional mandates is faulty and misleading to the public.
he says the faulty data includes false positive COVID tests, which make it seem like there are more cases of COVID than there are. And also how the CDC is coding COVID deaths. He cites a CDC alert released March 24th.
That changes the way that we've been recording deaths and calculating mortality rates from individual diseases for the last 17 years.
Dr. Hall says this method makes it seem like more people died of COVID than actually did. And he said the Board of Health has been using all this faulty data to influence decisions like closing down businesses, modifying hours of operation, and issuing mask mandates.
Small businesses in our community are the backbone of our community. And these mandates, limiting people in bars and restaurants, making people wear masks, generally scaring the public, is killing small businesses.
For more perspective on these claims, we consulted two people with no connection to the lawsuit. Dr. Manoj Jain, a Memphis infectious disease specialist who consults with the World Health Organization, and Stuart Harris, an attorney who teaches constitutional law at Lincoln Memorial University. Dr. Jain says he believes strongly that masks do work.
Lancet, which is a well-known journal, looked at multiple studies, and what they found was there was over a 5-fold decrease in transmission when people were masking. So transmission was over 17% when there was no mask, and when there was a mask, that transmission rate came down to about 3%.
Dr. Jain also interprets the risk of getting COVID differently than Hall.
If you get diagnosed with this, you have a 99.74% chance of being just fine.
About 0.26% will have a hard time and end up hospitalized in the ICU and die. You know, that 0.26% will come to 860,000 people dying. I don't think that's acceptable when we can prevent it by simple masks.
Now to the constitutionality of the actions by the Board of Health, like issuing mask mandates and closing businesses.
As tough as it is to believe sometimes that a small group, an unelected group of people has such power, well, they do. It's very constitutionally defensible, and I think that probably it would withstand this or any other court challenge.
Harris says in a public health emergency, the governor can delegate power to local boards of health, which Governor Lee has done. Hall's argument, this isn't actually a public health emergency because of the faulty data. And his main goal in filing the suit?
Ultimately, we want the mandate to be removed, for it to be left up to individual citizens to choose to wear a mask or not wear a mask based on their own individual risk.
Well, we contacted the Knox County Law Department, which is representing the Board of Health and also the Health Department here in Knox County in this suit. They said they do not comment on pending litigation. The county did respond to the suit, though, with a motion to dismiss, a motion to strike, and in the alternative, a motion for a more definite statement. We have links to both lawsuits and the county's, to both the lawsuit and the county's response on WBIR.com and on the WBIR app. And if you'd like to see the story again, you can find it there.